Hi guys, I'm Dr. Sandeep, your surgery guy. Congratulations to all those guys who have been allotted colleges in their first round of counseling. Kudos to your efforts. Great going, right? Now, especially from my side, I would like to congratulate all those young budding surgeons who have taken surgery as profession. You are now a part of clan, right? Now you belong to us. You are one among us. I'll tell you, the journey is going to be amazing. It would be fantastic. You just need to believe in the process, right? Now, since the allotments have been there, I've been bombarded with a lot of messages. Especially one of the most consistent question that I've been receiving is, sir, how do I approach my first year of residency, that too in surgery, right? Now, I don't say, much have changed from the days I have been into residency. So with whatever experience that I have, or whatever information that I have, and whatever I have experienced, I would like to share with you so that you survive your residency in the best possible way. Before we start this small talk, I would like to tell you the most important thing of being a resident is to enjoy being that particular resident. Nobody can replace that what you have achieved right now, and nobody can take that place. Guys, you have worked day in and day out to be at a place where you are. Imagine, go back, when we were in probably 5th 6th standard, we dreamt being a doctor. We were in 10th class, we did all the hard work, we went into +1 +2, we just outburned the competition, and then we went to medical school again, we outburnt it, and now you are standing where you belong. Now that is something that you should be absolutely proud of. There's nothing left to achieve more. You are an overachiever. So forget about, am I going to do well, will I be able to sail through? You've already done well, my friend. You are amazing. You have to believe in that, right? Now, how do we approach it? Now, residency is slightly trickier. You have to enjoy it, but you have to be responsible as well. This will start teaching you to take, those moral heavy responsibilities. You will now become more responsible. You will become more commendable. You will be more answerable. You have to measure your every single action. Every word that you speak will now have some weightage. You cannot just speak what you want. You need to start learning it. So the life has a peculiar way of teaching it, and one of the best way is through your residencies, right? Now, how do we approach it? Now, what I'm going to do is I'm going to break it down into 6 small topics, or the small points which will guide us in a way that you'll be able to deal well in your residency. Now, the first thing I would want you to be very, very, very considerate is for being humble. There's nothing wrong being humble, right? In fact, you have to be humble. You have to stay grounded. You are in a field where you interact with people. You're treating people, you're changing lives, you're saving lives. You need to be humble. Never let that pride sit on your head, because that is when you trip off, right? Now, what I mean being humble is the day you join your college, you will report to the college, then the college will tell you to go meet your HOD. You will go meet your HOD. The HOD will allot you a unit. You will go down to that unit, report to your unit chief. Once the reporting is done, then you make sure you meet every single person in that unit. If there is an AP, you have to go meet it. If there is, an SR, you have to go meet him. Now, if there is your, other people around it, whoever it is, make sure you go introduce yourself, right? There is nothing wrong, you can't be like, let him come and meet me. No, you have to make an effort to go meet every single person. That's just a way of saying, thank you, I want to learn, I am excited being here. So you're showing that gratitude, which is nothing wrong about it, right? And the most important people that you have to go meet are your senior residents, your third year resident, your second year resident, the guy who was waiting. I'll tell you, the most happiest person in that unit when you enter will be your second year resident, right? Because he was first, now he's becoming second year. You are taking over the first year job. Now he is the one who is actually waiting for you eagerly, right? Don't get shocked if you get a huge hug from your second year. It is not what it looks like. He is not happy that you have come. He's happy that you have come, right? So it is a reliever for him. Now, when I say being humble, don't have that attitude or arrogance. Know that, I'm the topper of the batch. I've got the best rank in need. I've got in the best college in India. whatever it is. You need to realize you are among the same people. You're at the same level. All those people have come before you, had a similar ranks. They are also overachievers. They are also from the same pedigree. They have cracked NEET. So they are here, where they you, right? So you need to understand that everybody there who has come before you are of same level. So you're no big different. And my friend, you are entering into a branch which is not driven by knowledge but skill. It is the skill set that matters. It's an art form. It takes years to master it. You have to stay humble to the craft. Make sure you absorb it. If your senior tells you to do it, you do it. You do it then and there. No questions asked. You will realize it later. See, in surgery, we say the million ways of doing the same thing. It all depends upon what suits you, right? What is your comfort zone? Which method or which technique do you have a calling for? You start attaining it. So there's nothing wrong. Learn from 10 different people. You should know 10 different techniques. You never know which one would be required for what. So do not question it. Just make sure if your senior is saying that, have a bit of faith, because he has put in enough amount of days, hours in that particular hospital to know what the protocol is and to know what things to be done in which particular way it has to be done, right? So you have to make sure you follow it in that manner. As we say in surgery, it is not about to learn what to do. It is to learn what not to do. Because once you know what not to do, you will not harm the patient. Anything beyond that is acceptable. Just keep your head down, be calm, be stable. See, even if your seniors, when they come down and they look down upon you, or they say derogatory things, I know it is not a good thing to say. It is not a good way to greet a person or a people. You should have that mutual respect. I don't endorse it, being bully and all. But if you come across a bully, just remember this one phrase. It's a magic phrase. Huh? Just remember this. Say it in your head. This too shall pass. Nothing else. If he is rude, this too shall pass. You'll go to the next day. After a year, he'll go, or after 3 years, you will leave the college. You go to some other place. This too shall pass. Don't let the outer atmosphere affect your inner atmosphere. You have to keep yourself calm. Everything that is going around you, which is negative, is not meant for you. Let that happen. Move on, right? So stay humble. Be accommodative, learn everything that you can. Go meet, in fact, when I say humble, you go meet everybody in your department, your clerk, your ward boys, your sisters. Make a rapport, right? You go meet everyone. Just show that you are a humble person. You're there to learn, and trust me, your journey will become much, much more easier. Now, the second piece of advice. Now, this is a serious advice, right? Anything, let it be anything. You screw up to the highest possible level. Remember, do not lie. You didn't check vitals on the patient. Say, sir, I didn't check it. I'm sorry. You don't remember the values. You say, sir, sorry, I don't remember. I'll check back and tell you. If you forgot to post a case which your seniors have asked you to, you tell them, sir, I'm sorry, I forgot. Yes, they will screw you. Yes, they will scream at you, but they'll always respect you, saying that this guy doesn't lie. Right? For example, if in the morning rounds and your consultant is asking what is the serum sodium level, right? And you didn't check and you say it is 140. 140 is normal, you move on. What if it was 110? He was hyponatremic. You're not correcting it. He's going to go into severe reciprocations. You don't want that to happen, right? Let's say your morning rounds, your senior is asking how much is the BP. You didn't check it. You say it is, sir, 120 by 80. What if it is 200 by 110? You never know, right? He's hypertensive. You're taking for surgery. On table, anesthetist will find out. Again, your chief surgeon will get to know. You will get screwed. So remember, do not lie. Let it be anything. You forgot, you forgot. You don't know, you don't know. If somebody, and one more very important thing, if they ask you a question and you do not know the answer, all that you have to say is one magic phrase. Sorry, sir, I don't know. I will learn, I will read and come back, right? So this is the only thing you have to say. Yes, at that particular moment, they will screw you, but then thereafter, you will get better. Now, I've been telling you, they'll screw you, but it's in a way that, the intent is to make you learn, but the way they do it is not, in a very compressive manner or very, comfortable manner. They do it. But yeah, I do get it, but this is a harsh reality, right? So you need to absorb it, but remember, do not lie. No matter what, do not lie. The third piece of advice is make contacts, right? Talk to people. You should have, you should have 4 people's contact always on your phone. The first one is your ward sister, right? The second one is your OT sister, third one is your casualty sister, and the fourth one is your ward boys, right? Now these are the guys who are going to help you make your life easy. The ward sister, if you're good with her, if you're accommodative, and if you're humble, to all of them, whatever you do, that nitty-gritty small problems or mistakes in the ward, no, your ward sister will cover up, right? She'll make sure it doesn't happen. Your OT sister will allow you to operate. She will give you OT when required. She'll make sure your life is smoother, right? Your ER sister, that casualty sister, she will let you eat, because when you are posted for duty and if the ER is damn busy, and if you don't have a good contact, your life is going to be hell. If the casualty sister is good to you, she'll make sure that you have food and then treat your patients, right? So make contacts. Along with that, no, not only in your own department, you should have contacts with your medicine department. Difficult guys to deal with, but yes, you need to be good to them. You need to have a good contact with anesthesia people. You need to have good contact with the radiology people and the ops and gynae people. It is ops and gynae, it's vice versa, other way around. They should have good contacts with you than you having them. But again, you might get a potential life partner, right? So why not, right? Go have good contacts, look out, watch out. Another piece of advice, right? When I say make contact, it's not a physical contact, right? Just refrain from having a physical contact. But more importantly, all these contacts, no, will also help you in future, right? As you graduate out, when you start practicing, you'll have people, who are going to practice along with you. Your life will become much more easier, right? So you should have good contacts. You should make good contacts. Try to help them when they call you. If your medicine guy is asking for a surgery advice, you go help him out there, right? If you're radiologist, and remember, if you're not good to radiologists, no, majority of your cases will get delayed on a radiology clearance table, right? So you need to have that. Anesthesia, again, it doesn't go saying that, a surgeon cannot operate without anesthetist. That is a true fact, right? So you need to have a good cordial contact with these people, right? Now, the fourth piece of advice is ER and casualty. Spend as much time as is possible. Trust me, it looks sad. If you tell that, how did you spend your weekend? I spent in a casualty, I spent in ER. It sounds bad, but it isn't that bad. The more time you spend in ER, the more time you spend in casualty, you will feel good about it. You will learn. Now, remember, ER and casualty is your learning ground. It is actual battleground. You get to do suturing, you get to do assessments, you get to make your own diagnosis. You get to treat patients down there, because once they go into the OP and then to the ward on the OT table, your seniors will take over. Being in ER, you will learn a lot of things. You will start introspecting, start questioning a lot of things, and that is where you will become a better clinician. You have to make sure you sleep in ER, you eat in ER, you drink in ER. You see, initially when you go, no, especially in government hospitals, the ER things, right? It's because of a lot of people that flow in. To maintain that level of hygiene is difficult from the point where you've come in. But trust me, after 1 month, you get adjusted, you get accommodated. That smell of ER initially, which you had that negative repercussion, you'll start loving it. You'll be like, okay, cool, I belong to this place, right? And if you're available in hospital, no, people will respect you. You will know more people. The patients will respect you. You will start integrating a lot. You can get things done pretty well. The possibilities are endless, right? Stay in ER, and remember one very important thing. On your duty day, the first thing you have to do is to go sign your name and phone number on an ER register. Inform the ER sister or the casualty sister that you are the PG on duty or on call, and then make sure you give your number to them, and take their number as well, right? Because whenever an emergency, they should not try to find you, but you should be readily available and accessible, right? Then you go down, do your ward rounds, go to your OP, and then continue your day. Another very important piece of advice is, if your day starts, let's say if your round starts at 9 o'clock, you have to start coming to the hospital at 7 only, because initially it will take a longer time to do your rounds for assessment of the patients. But as you move on, after 1 year, you might finish the rounds in half an hour, 45 minutes. But initially it will take a good bit of time. Another very important piece of advice, you have just come from being an intern to a PG, and you know how important an intern is to a PG, right? So you need to have that one good intern who you can fall back and rely, because that will be your fall guy, right? Anything, whoever who says whatever, no, you feel bad, you want that vent out, you want one person who you can talk to, let out, without being judged and without being, that information being propagated to the next person, and that is your intern. So have a good contact with the intern as well, and they would like to learn from you. And the only place where you as a first year can teach an intern is your casualty, because everywhere else your seniors are going to take away, right? So develop that ecosystem, right? Stay in ER. The fifth piece of advice is how to deal with toxic people. Now, this comes without saying that, as not only in surgery department, every department will have some amount of toxicity. There'll be people who are toxic. See, the department per se or the branch per se is never toxic. It is the people who work there, right? So you need to understand, if you encounter toxic people, the only thing you have to do is whatever they say, don't take it to heart, don't process it to your brain, just listen and leave it, because being toxic is their agenda, right? They don't want to make any changes in you, they don't want to improve your life, they don't want to improve you as a doctor or a learning curve. So when you're not getting anything which is productive, why do you want to take which is non-productive, right? Just see, all that you have to do is stand, put your head down, and let that toxic person do whatever he wants to say. Yes, sometimes you will feel, that I may not respected. Sometimes you will be embarrassed, he will start shouting in front of people. But trust me, everybody's looking around. No, they aren't feeling that you have done anything wrong. They are feeling bad because that person is shouting at you. So all that negative vibe is to that person, not to you. Just put your head down, let him speak. Always have a vent out. Talk to your parents, talk to your friends. Always maintain your friends, keep that in mind. One more important thing is, a lot of residents, even before joining, all you guys who have just finished your NEET, or who are in internship, they start talking about work-life balance. What is work-life balance? Yeah, you are now in a phase where you're working to bring balance to your life. You can't, expect a work-life balance now. I, being at this position right now, I don't have a work-life balance. I have to work in order to attain balance. That comes after a while. See, if you want to achieve something, the work and the life balance is what is your expectation from life, and how are you able to reach it at what particular time. That is your work-life balance, nothing more than that, right? Yes, family life is important. Yes, personal life is important. Personal health is important. Professional health is also important. Everything is important. How do you balance it? You pay utmost. You be true to yourself, right? You're working, you work. You're taking a break, you take a break. The problem comes when you're working and thinking about break, and when you're taking a break, you're thinking about work. Don't do that. Just be in that zen. And whenever you get time, in residency, sleep as much as you can. Trust me, बेड से ज्यादा बेटर दोस्त नहीं मिलेगा, ठीक है? So sleep whenever you can and however you can. The last piece of advice is about resources, right? Now, as a first year resident, no, I would not like you to pounder on resource, right? The first year is only to learn, observe from your casualty, from your wards, from your seniors, from your OT table. Yes, you need to have a bit of resources so that you go OT prepared, but you don't have the time to sit and read. That is your second year, right? The books that you're going to read will be second year. First year, you wouldn't have time. It's very difficult, it will be very cruel also, or very unrealistic advice that you start reading these books. No, it isn't that way. The first year, you have to put your head down, just learn from the best, understand, analyze, and observe, right? Now, if you're talking about resources, there are 3 textbooks that you should have. Number 1 is Das, Senior Das. Without Das, can't do anything. So you need to have that one small, you have that book, no? Das, as Das, open, page, flies away, right? That book. Second book you need to have is an operative manual. Somebody says Focus and somebody says Mastery of Surgery. Anything, but have PDFs of it. Don't buy books. Keep PDFs so that you'll be able to, read whenever it is required rather than carrying a bulky book. Third one, without saying, it has to be Bailey and Love. Yes, it looks like a basic book, but ask yourself, jhaak ke pucho, question yourself, have you read it? Right? 28th edition is out. Did you even bother looking at it? Right? So you have to read Bailey and Love. and Sabiston, right? These are the books that you should have as a first year for reference basis and to look whenever required. For fluids, there's a book called as Sanjay Pandya. You can keep it, but again, you'll learn, you'll evolve, and that is how you continue to do so. So resources for the first year are your seniors, nothing else. Casualty, ward, OT, seniors. These are your resources, stick to it. Second year, there's a different source of mine, right? Now, if you follow these advices, your residency will be pretty easy. You have chosen a path which is not easy, and then expecting it to be easy is stupidity, right? So don't think in that manner, right? The most important thing is to enjoy, right? Love what you do. Don't bother about what people are saying. If somebody's saying you're not born to be a surgeon, you're not skilled to be a surgeon, you don't work like a surgeon, you don't operate like a surgeon, I mean, you don't assist like a surgeon, you don't have anything that requires to be a surgeon. Trust me, whoever is saying that is just saying out of insecurities, right? Because nobody can learn the art of surgery in a day or so. It takes years. Okay? Even suturing will take time. Even the best, even today, no, as we continue to suture, we become more refined, and this is a lifelong process, right? Refinement does not have an end. You are only as good as you think. Now, if you think this is enough, it is okay, but you think you want more, you want to do better, there's no limit, right? So this is all that I have for you guys. Enjoy the process. Always be happy. When you go to the hospital, go with that excitement, right? Just remember, once you come out, there's a lot of people that you want to treat, right? All the best, guys. And anytime you want to reach out, you know where to get it. Thank you.